Welcome to today's webinar presented by SuperCoder.com. SuperCoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Anatomy of the hand, and I'm going to share with you that chart I have, and then I'm going to talk about some modifier issues, and then we'll go into the actual presentation itself. So let's start now because we've got a lot to go through. I'm assuming that a lot of you work for orthopedic surgeons or plastic surgeons that are doing hand trauma, and so you're getting a lot of your patients to the emergency room, whether they're being seen by your providers in the emergency room and then going to the OR, or they're being sent by the emergency room to your office and then to the OR. And we're going to talk specifically about some things relative to that in a couple of the presentations here, or the case studies. So let's go ahead and get started. I hope that everybody's printed out the actual case studies that were in the PDF format, because it's going to be really important that you have those. I mean, it'll be nice for you to have them later after the presentation so you can take another look at them, but I hope that you have those, and if you haven't printed them out, go ahead and do that so you have them when you're going through this presentation, because you can reference them. All right, so looking at the diagram of the hand on slide number 2, there are several things we need to know when we're talking about trauma. And the first pictures, or the tendon zones, are important, especially when we're talking about the flexor tendons, because there are codes that relate to what zone we're repairing flexor tendons. And so I've given you the picture of that. And I've had this diagram for years and years. I have no idea where I originally got it, but it has been I've had it forever, and I use it all the time, and because I really like the information. Then the second set of pictures is the actual bones of the hand and wrist. It does document each one of the 8 wrist bones, and then it also shows you the metacarpals, the phalanxes, and whatnot on the hands. Then there is the last picture at the bottom is a picture of the nail. And as some of these trauma cases where the nails have been destroyed or injured also, we need to be able to document and report the repair of those. And so that is a nice diagram there of the actual and tip of the finger with the nail involvement. All right. The next 2 slides have the finger modifiers for both the left hand and the right hand. And if you notice on the left finger modifiers, they are denoted by 2nd digit, 3rd digit, 4th digit, 5th digit. What I have gone ahead and done is added in parentheses after each one what else they can be called. For instance, the 2nd digit is also the index finger. I normally see the providers documenting based on, they don't call them the 2nd, 3rd, or 4th digits. They use index, middle, ring, or little. And so I've given you that information here. I also have used a lot of abbreviations in this presentation, and I will read them often as we go, but I want you to familiarize yourself with them because I see them a lot also in operative reports, and so I want you to be able to recognize those when you do see them. So we'll talk about those as we go. Then going on to the next slide, you see here that the right finger modifiers are very similar to the left in the fact that it goes thumb, index, middle, ring, and little. And so those are our modifiers. Okay, so the next slide actually tells us what we are looking at relative to the use of the finger modifiers. So you want to use your finger modifiers when you need to designate the difference between fingers.
SuperCoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.